So today's talk is about reversing and managing diabetes, specifically type 2. So type 1, the difference is it's something that you're born with, juvenile, you're insulin dependent, your pancreas doesn't make that. Type 2 is a little bit different, and I'm going to get into what is it exactly happening and how we can fix that. So the first slide I want to talk about, and this is really important, is the number of people that have, quote, pre-diabetes. And I really do not like that term. If you go to the doctor, they're going to tell you you're pregnant or you're not pregnant, right? But they like to use the term pre-diabetic. And in my opinion, you're either diabetic, you have a problem with your blood glucose regulation, or things are normal. So in America, this is from 2018, so it's a couple years old. I wouldn't be surprised if the stat is worse now, but one in three Americans, adults, have pre-diabetes. So that's a problem because, and the number has changed. Traditionally, they'd say if your glucose was over 120, that's where you're diabetic, or and they dropped it to 110, and now it's 100. So if you check your blood and it's over 100. Really that's diabetes. But a lot of medical doctors will say, well, you're in that 120, 130 range. It's pre-diabetes, just kind of watch things. And at that point, they don't really have a management way to do that. And they'll say, here, take some metformin, right? And the metformin will help to take that extra glucose and make your muscles and your tissues absorb it. But it doesn't really fix the problem. So the big thing is talking about the difference between managing symptoms and actually reversing diabetes. So your traditional medical doctor, they are going to manage symptoms, and you mentioned some of the things that you're taking, which is on here. They manage it by giving you a drug to help get the glucose out of the bloodstream. Too high of glucose levels is downright deadly. So they have to do something, but to be fair, you can manage your diabetes by just watching what you're eating, but it doesn't truly fix what's going on. So I want to dive into the nitty-gritty of what's going on with this condition and how to fix it. So what the big picture is understanding, and I like to say this, doctor is Latin for teacher. And so some of the terms that I'll use, hopefully they don't go over your head, but I want to try to explain exactly what's going on. So the underlying root cause of diabetes is actually something called insulin resistance. So basically the cell, and the lining of the cell, it becomes thickened and the sugar is not able to get into it. So I have a slide here, and hopefully it's not too busy to be able to read there, but it says, imagine your body is like a house and sugar is the energy that you need to keep the lights on. And insulin is like the key that unlocks the door to let the sugar into the rooms. If you eat too much sugar for too long, the locks, they start to get rusty and not working well. And the key, which in this analogy is insulin, it doesn't open the door easily. So the sugar stays stuck outside and it just floats around in your body, in your bloodstream. And you need more and more insulin to try to force it in. And over time, your body wears out and the sugar starts to cause damage, and that's what insulin resistance is. And from a medical perspective, what they do is they end up giving you more insulin. So your pancreas, it secretes that hormone to grab and bind the sugar, stuff it into the cell. But when the cell's thickened and it's resistant, then you start to have to take medication to get that to push in. But you need that glucose to go into the cell to make energy. And again, if it's too much in the bloodstream, it'll kill you, right? So I'm not saying that allopathic traditional medicine is bad in the sense that, yes, if you have elevated sugar, we got to do something for it. But my goal is through modifications of lifestyle and diet that we can actually fix the root problem, and that's the insulin resistance. That's fixing that thickening, right? A whole slide on different risks that go with insulin resistance, type 2 diabetes, and really there's another term for this. It's metabolic syndrome. So, when you have that inflamed cell, your whole body starts to break down. So you can have brain issues, heart, weight, eyes, nerves, kidneys, inflammation. My grandfather, he had type 2 diabetes. He had all these problems. And it's a result of having that elevated sugar that his body wore out. So he got to the point that he had a quad bypass heart surgery. He was on dialysis. He had toes amputated from neuropathy. He was overweight. He had breathing problems. He had all these problems, and the medical doctors just gave him pain medicine and stuff for his diabetes. It didn't fix the problem, and he died in his early 70s. Basically, if you can grasp this slide right here, this is how we fix it. I'm going to dive into all these different parts, but the cool thing is, in teaching this and going over it, a lot of the different things you don't have to see me for, okay? There's going to be parts of it that we can help at Blue Mountain Wellness, but a lot of it is going to be on your own. So I'm going to dive into each of these subcategories, but chronic stress, lack of movement, processed seed oils and really processed foods, poor sleep, gut dysfunction, environmental toxins, artificial sweeteners, and mitochondrial dysfunction. And I'll explain what these different terms mean as we go. So Hippocrates said, long before Jesus roamed around here, at least he was attributed to saying, let food be thy medicine and medicine be thy food. And that doesn't hold more true today. What you put into your body is the fuel that your body thrives on. And if you look around today, when we thrive, we don't really thrive, but a lot of people live on processed foods, and we have all these different chronic conditions going on. So one of the big things that we have to talk about for the diabetic population, to fix it, we do need to avoid sugar. And the reason is we got to start to reduce inflammation. Until that inflammation is reduced and the cells are working right, we have to definitely reduce sugar. So if you can tell, there's sugar cubes in the cup. And ironically, some of these beverages that we drink literally have that much sugar inside of them. This one, I can send a picture of the slides then that has all of it, but a lot of the sugar that's in food hides under a different name. Some of the names make it sound natural, some they kind of stick out at you. Most people know like high fructose corn syrup by now. But sugar, I'll see on labels too where it'll say cane sugar, and then further down the label you'll see high fructose corn syrup. So really there's 2 doses of sugar in there. Some of these companies have gotten smarter because a lot of people know that when you look at the ingredients, towards the top of the list, that's going to be the most abundant ingredient. So they'll actually break up the sugar as 2 different things so that it can be kind of shoved down further. A good thing to look at too, if you're not really sure, is how many calories, because that's a unit of energy, which is what sugar is measured in. How many calories does the beverage or the food have? But we definitely want to reduce sugar to heal things. So this is the one, and they put a little animated thing here. Artificial sugar. I'll have patients all the time I'll sit down with and talk about diabetes and their sugar levels. I'm like, no, I just drink diet and I just do this and that. And it just makes me cringe because their medical doctor or even some of the nutritionists say, replace that with artificial sugar. And I have a couple slides to talk about why that's actually bad. The first thing is it confuses your metabolism. So your brain's really smart. So when you taste something sweet, because that's what they do, your brain says it's sweet sugar, and it signals the pancreas to secrete insulin. And when we have an insulin sensitivity issue going on, when we have a blood sugar dysregulation and you need a lot more insulin, that pancreas is already getting worn out, right? So right there, that's not giving that pancreas a chance to just relax and reset. So that's the first problem. The second one you don't think about, is it actually disrupts the microbiome in your gut, okay? And the gut is really, really important to have a good ecosystem there with good bacteria to help process and digest food. And what ends up happening is it gets replaced with bad bacteria. And that can lead to leaky gut. And that's something that we do help treat leaky gut patients at the clinic here. And then lastly, again, it can stall your fat loss, because the sugar itself will actually, for some patients, it'll increase their appetite, and then they end up eating too much. And the last term on here, ketosis, we're going to talk about here. So even if you have good willpower, you say, well, I can drink a diet soda and it doesn't make me hungry. Just know that it actually physically affects your stomach, and your brain is triggered into making insulin when you really shouldn't be. And that's what that can lead to, okay? All right, so some more ways to decrease sugar. Ketosis. Are you familiar with the term ketosis?
Somewhat.
Okay, so there's some fad diets out there, carnivore diet, Atkins diet, and then ketogenic diet. And the basic premises of all of these diets is that you consume under 40 carbohydrates a day. After a couple days of that, your body needs energy. So if you're not getting all that glucose in, that easy sugar to get in, your liver will start converting fat into ketones and use ketones as energy. And that's where the term ketosis comes from. Ketosis is good for a lot of patients. I have a slide that says some of the contraindications, but by and large, if somebody has diabetes, weight problems, they have metabolic issues going on, I really strongly recommend to do a ketogenic diet to get their body using ketones for fuel. Basically, with the ketogenic diet, you're going to take the food pyramid and flip it upside down. The fat at the bottom here, that's an entire other presentation. Everybody's scared of fat, everybody's scared of cholesterol, and that's a whole other topic, but you have to just trust me that, and there's bad fats, but good fats are okay for your body. But you want to get lots of fat, protein, and very little carbohydrates. Like I said, keep it under 40 a day to stay in that state of ketosis. Another thing that can be really beneficial is called intermittent fasting. Have you heard of that? Mm-hmm. Okay, so one of the classic ones, it's 16-8. So basically, from lunch till about 8 o'clock at night, that's your window to eat. And it's a really nice one, because as long as you're on a regular shift, from 10 o'clock or whatever time you go to bed, you're sleeping, so that 2 hours after you eat, and then that 8-hour window of sleep, you only have to really fast from the time you wake up to lunch. So it makes it pretty easy. And what that does is basically every time that you're putting food into your body, right, you have to digest that. So by giving yourself a break, that's giving your body a chance to reset and to heal itself. So a slide here just about who it's good for. Again, with this topic, pretty much anybody with type 2 diabetes, looking to do glucose regulation, blood sugar regulation, is going to really benefit from. And then the ones that shouldn't do it, obviously if you're pregnant, if you're a kid, there's certain cases you don't want to do that. A big one I want to point out is adrenal fatigue or chronic stress. So if you're under a lot of stress, just be careful, easing into that. And I have a whole bunch to talk about with stress then. Okay, movement and muscle. So we're still under the category about reducing sugar. This is actually one of the easiest things that you can start to do immediately. After you eat a meal, go for a nice brisk 30-minute walk. Get the muscles moving and firing. Your muscles will start to absorb a lot of that extra sugar. Doing resistance training to work on building muscle, and I'll dive into that more. And then mini circuits at home, like my picture. With online, you can find all kinds of different stuff, but just getting the heart rate up and recruiting muscle activity. So your muscle, it's the biggest resource to use glucose to uptake it. So we want to get that extra sugar out of the blood. And up to 80% of your glucose goes into your muscles. So if after you eat, you go for a walk, you work out, you exercise, you'll start to burn that extra glucose up. That way, you're not relying on your pancreas to secrete all this insulin, okay? Because we're trying to get away from, I eat a meal, I check my sugar, and then I give myself an insulin injection. We're trying to get away from that. We're trying to heal you, right? Muscle burns calories at rest. So just having more muscle mass, you'll actually burn more energy. And I had a teacher in 6th grade. She was a bodybuilder, and she ate an enormous amount of chicken. I don't even know how she ate that much food, but she was completely lean. And it's because she had so much muscle mass, she needed all that energy in her body. But she didn't eat, a bunch of processed junk foods. And most importantly, the muscle will help improve your insulin sensitivity. So we want an increased level of insulin sensitivity. That means that the more sensitive your body is to insulin, the easier it is to unlock that door to get the sugar into the cell. So that's the big thing we're trying to do, increase that sensitivity. And muscle protects against chronic disease. So once again, this goes back to that earlier slide. When you have elevated sugar, elevated inflammation, you're at risk to diabetes, obesity, fatty liver. And the last point, this is something that's emerging research. Alzheimer's is being linked to something called type 3 diabetes. And type 3 diabetes is actually insulin resistance to the brain. So bottom line, the more muscle you maintain, the more efficiently your body burns fuel, regulates sugar, and stays metabolically healthy. Okay, cortisol. So going back to, I mentioned about a lot of stress. Cortisol is known as the stress hormone. High levels of cortisol in itself will raise your blood sugar. So just having stress can raise the blood sugar. And over time, that itself can lead to insulin resistance. So benefits of balancing cortisol, we want to improve that sensitivity of insulin, reduce the glucose spikes, and with that, let me jump forward here. I got 6 steps here. This is what I'm looking for. Okay. So, reset your rhythm. Circadian rhythm is really an important part to cortisol, and it actually overlaps with other functions of the body. In the morning, you want to wake up with the sun. So, and ideally, when you wake up with the sun, you have that golden hours, morning and twilight, to go out and actually take that sunlight into your eyes and your body. It's God created this amazing body. When you take that sunlight in, it knows that it's morning, and it'll start to help sync your body more in the rhythm. So you don't want to have sunglasses on when you're doing that. At nighttime, avoid the screens in the evening, and that'll help to lower the cortisol as well. There's more research on that too. The blue lights on phones, on your TV screens, everything's backed by a blue light. That actually stimulates your pineal gland, and your body thinks it's still daytime. So if the sun's already down and you're on a screen, your body's it's messing that whole circadian rhythm, like getting you out of sync. It takes about 4 hours for your pineal gland to secrete melatonin, which is what naturally puts you in that deep restful sleep. So if you're up on a screen till midnight, it could take till 4 o'clock in the morning before you get in that restful sleep, and then your alarm goes off at 6, and that causes a lot of stress that raises your cortisol. And again, the cortisol can cause the insulin resistance. So we want to get 7 to 9 hours of uninterrupted sleep. Trying to avoid eating and doing a lot of intense activity right before bed. Okay, the vagus nerve, I have another slide on this. The vagus nerve, that's your main nerve for your parasympathetic nervous system. So you have sympathetic and you have parasympathetic. So that has to do with resting and digestion. One of the things you can do to stimulate that nerve and to get yourself into that restful state is breathe slowly. So there's actually a technique called box breathing where you can breathe in, and you can do it for various sets of time, but there's 4 steps to it. So there's the inhale, and you'll do that for, let's just say 4 or 5 seconds, and then you hold for 4 or 5 seconds, and then you'll exhale for 4 or 5 seconds, and you'll rest before you inhale again. And that'll get you to that 4 to 6 breaths per minute. Humming, gargling, those things actually stimulate the vagus nerve. It runs all the way down the middle of your body. So you can hum the alphabet, things like that, but that humming actually activates the vagus nerve. And the cold face flashes, a lot of people are talking about the cold water plunges right now, but you can just put cold water on your body and it kind of shocks you back into a rhythm and relaxes you. Okay, support with food. I mentioned before, if you're under a lot of stress, you might not want to do the intermittent fasting. So if you have a lot of stress, high cortisol, don't skip your meals, high protein, healthy fats. If you're really stressed out, more sugar and caffeine, they're not going to be good for you. And magnesium is good. I'm a big advocate of food as medicine. So yes, you can supplement with magnesium, but your leafy greens, nuts, seeds, and avocado, they have a lot of that in there. And manage your stress. So if you got to pray about it, write it down, talk to somebody, just don't hold that in. Don't be quick you have to say yes to everything, have some boundaries. And one of the hardest things that's bolded there in our society is avoid multitasking. I mean, everybody's on their phones and watching TV or listening to a podcast while they're doing that, ignoring their spouse, all the above, because it's just too much to take in. Okay. And then if you need to manage stress too, instead of taking anxiety medications, things like that, there's some herbals, ashwagandha, rhodelia, holy basil. Those are a couple, but there's herbals that you can take to help reduce stress that are non-medication. Okay, another slide on the vagus nerve. Again, this one's an important one. Like I said, it's your main parasympathetic highway. We actually have the ability to test at Blue Mountain for if you're in a state of sympathetic dominance or if you're in a parasympathetic resting digestion. Most people that we see in our office, they're foot on the gas pedal, they're in sympathetic dominance. So the test that we use is heart rate variability, and it can help detect that. And then again, a couple of the same thing I talked about: breathing, humming, cold exposure. Okay, this one gets a little bit nerdy. So this is about cellular energy and mitochondrial support. So again, type 2 diabetes is really related to the cell and an energy dysfunction, right? We got to get the energy from sugar, but it has to get into the cell or it doesn't work, right? And that key, that's the insulins. A couple things that we have here: red light therapy. I'm going to touch on these some more. Red light therapy, hyperbaric oxygen therapy, some good supplements that can help with mitochondrial support: B vitamins, magnesium, CoQ10. Again, if you can get this from your food, that's all the better, but you can absolutely supplement with those. Those are really easy to get. Going back to this is how this all connects together. The cortisol, your sleep is really important for the circadian rhythm, and chiropractic care. I mean, we address the nervous system. The nerves connect to all 70 trillion with a T cells in your body. So, have you seen a red light bed before?
I haven't seen it, but I saw it on your lawn online.
Okay, so that's located right down the hall. It's really cool. It's got some more nerdy stuff: 660 nanometer, 850 nanometer, basically certain spectrums of the red light. Really, it's just taking what the sun has and it's packaging it into technology so we can absorb that without all the harmful UV rays. But good old sunshine is good for you too. So it increases your ATP, and that's just the unit of energy that your body runs on. Helps reduce oxidative stress, so not just mental stress, but actually stress of your body and inflammation. And then in doing so, it helps to heal nerves and skin and all that stuff. Hyperbaric oxygen therapy, this is something that we have as well down the hall. This is a chamber that you sit in, and if you ever heard of somebody with the bends from scuba diving, they have to go in that chamber because they're all messed up with their diffusion of oxygen in their body. We use this for a therapeutic effect. So when you sit in that chamber, it pressurizes, and there's an oxygen generator that pumps oxygen into the chamber. And as you breathe that in, you're actually able to get more oxygen in than your red blood cells can handle under pressure. So the oxygen starts to spill into the plasma of your body and does all kinds of cool stuff to help to heal. So I would definitely recommend that for somebody that has pretty advanced diabetes. It's great for people with neuropathy, wound stuff, concussions, anywhere that more oxygen's gonna help, that can help heal. It's a pretty amazing piece of equipment. And then detox. So at the very beginning, I talked about all those different things. Toxins are a big one. I could go on and on about the different toxins that we're exposed to. The reality is that, I mean, we can't get away from them no matter what. So your liver health is important because that's the main organ to detoxify. Saunas and the red light bed, those are really good because they can help you excrete toxins. They'll flush out your lymphatic system, and you want to just drink lots of water to hydrate to get rid of them. So, you know, if you can clear environmental toxins, avoid as much toxic stuff as you can. That could be your cleaners that you use at home, what you're washing your clothes in, what kind of candles you're burning, or hopefully not, what kind of perfumes that you're putting on your body, what kind of makeup you're putting on your body. All those different things there's a lot of ways that you can cut toxins out if you start to pay attention to stuff, but they're unavoidable in this day and age. They're just everywhere. And then there's also your home and your home toxins. You know, if you have a leak in your roof and you have mold in your house, I mean, that absolutely wrecks your body. Stuffed in there is seed oils. I'm going to talk about that some more. Those are inflammatory toxins. But toxins are tough. So like I said, that could be a whole entire presentation in itself. One of the things that we've done here at Blue Mountain, we're going to start doing again, is IV therapy. And with IV, we can help to reduce toxins. We can put glutathione in there, which is a major detoxifier. We can help with cellular hydration to help with all that inflammatory and thickening going on. And we can put antioxidants into the IV, so you can bypass the gut and get antioxidants, which will reduce oxidative stress. So antioxidant help repair with that. And then the other thing is, depending on symptoms, we might indicate a gut detox where we work on fixing the lining of the gut. So that's a lot to unpack right there. But toxins equal inflammation. Just know that. All right, here's a couple supplements. Everybody likes supplements. Everybody I talk to, well, doc, what supplement can I get to fix this? Everybody wants, you know, if every ill, there's a pill. And then people, well, I don't want medicine, give me a supplement. And supplements can be great, but they should supplement what you're not getting in your diet. So chromium, berberine, those are great for helping with just managing the glucose spikes. ALA is great for nerve damage, so if somebody has neuropathy, that's a really good one. Again, magnesium's good. And omega-3s. I'm gonna talk more about that. To monitor your sugar, continuous glucose monitor, that's the little thing that they stick in your arm. They have apps now, and you can really get a good sense of, you know, what types of foods or things trigger and spike your sugar. But again, whole food derived nutrients, we want to eat as much of that as we can, not just supplement with it. And I can't say enough, is to cut out processed foods. Okay, so foods can cause a lot of inflammation. And when I say inflammation, we're talking about the cell. And again, that cell's inflamed, it's hard to get the sugar in there. So seed oils, that is something that I can't stress on enough. Seed oils are highly processed oils that come from seed derivatives. And they're very high in omega-6. So when I talk about seed oils, that could be canola oil, that could be anything from soy or corn, cottonseed. There's a whole list of those, but basically they're highly processed. So what's easier is, and I have a slide on it, is to eat the healthier oils. You'll hear a lot about omega-3. People talk about for inflammation, take omega-3, and a lot of people don't know the reason behind that. So your omega-3 and 6 ratios should be as close to equal as you can. Omega-3s aren't everywhere. They're both these nutrients are essential to our diet. Our body doesn't make them, we have to get them in. But in America, we get all kinds of omega-6 because it's so prevalent in processed foods. So one of the things that people do is they'll take fish oil or krill oil. It's easy to get those in the capsule, and you can swallow them, and you're getting your omega-3s, and it's helping to balance that ratio, which helps to reduce inflammation. But the bigger picture is you should try to reduce the amount of omega-6 instead of just supplementing with omega-3, okay? So a good tip here too, to avoid processed foods when you go to the grocery store, shop the outer perimeter. In the middle of the grocery store, you have all these aisles, and that's by and large all packaged stuff that's meant to last for a long time. You know, on the perimeter, that's where they have the refrigeration stuff, and you have the perishable things. By and large, that's a really good tip to try to get your groceries around the outside. Okay, so what to use instead of the seed oils? Olive oil is great. The extra virgin's even better. Avocado oil, and you can find a lot of products too if you're looking for a snack type thing that are made from avocado and coconut oil derivatives. They're a lot easier on your body. They're not nearly as processed and refined, which makes it easier for your body to digest. Two of the best ones, grass-fed butter, ghee, and tallow. Tallow is like from the fat of an animal. And then, you know, butter or ghee are good, but I would definitely get grass-fed, because if you're eating regular butter, those animals, those cows are eating lots of corn and grain, which are high in the omega-6. That's the reason why grass-fed butter is better, because what they're eating ends up being what you're eating, right? As far as cooking, if you want to try to eliminate free radicals, your best bet is to cook with grass-fed butter or tallow. And then the nuts and seeds, those can be good sources of fat too. So if you're doing the ketogenic diet and you're trying to get that fat in there, because again, your liver makes the ketones from the fat, right? So you got to get that. You got to get a fuel source somewhere. So nuts and seeds can be really good for that. Okay, it's a lot of information. So I'll get a printout or a PDF for you here. So we're gonna do a little recap. So again, just remember, food's the medicine, right? Whole foods are gonna be the best. So you wanna reduce your sugar. So look at the labels, watch for hidden sugar. We wanna increase your insulin sensitivity, right? We wanna be able to use less insulin to get the sugar into the cells. So while you're trying to reset your body, low carbohydrates and whole foods. The intermittent fasting, get your body into ketosis, so you're not having to absorb and use sugar. That's going to let all those organs rest, those cells to repair. So the 16 hours of no food, 8 hours of eating, lots of healthy fats and proteins as your fuel, and then gut health. And again, I have a whole protocol and program for that. It's something we can always talk about, but fermented foods can be really good for gut health, fiber for motility. Fermented foods, that's like, you know, kefir, sauerkraut, you know, anything that's like kind of pickled and fermented, that can be really good for the bacteria, the good bacteria that helps with digestion. And then try to eat at home as much as you can. In the restaurant world, I mean, they fry stuff, they use a lot of seed oils. So when you eat at home, you have control of what you're putting in your body. And then we talked about the muscles being the main primary way to absorb glucose. So work your muscles, walk after your meals, do your resistance training, do your home circuit of stuff. The more muscle mass you have, the better, because it's going to help to burn that extra sugar up. Get your sleep. I don't think you'll have any medical doctor tell you that sleep's important, but it's extremely important, because your body has to be able to rest. I did read just recently this week, beyond 9 hours of sleep is actually not good. So 7 to 9 hours. Again, avoid processed foods. Watch out for the fake sugars. Say no to the artificial stuff. The toxins, try to avoid that. And then we talked about ways to stimulate the mitochondria, like a red light bed, and you know, reducing cortisol and resetting the body with what you put in there. Some stuff to help with accountability. You can't always have somebody there to coach you and teach you. So logging your food. just by writing stuff down, and that's where you got to be honest with what you, every time you put something in your mouth, write it down. If you have a continuous glucose monitor, pay attention to when the levels spike and look at that log. I mean, you can start to see patterns to zone in on how you can get that sugar reduced. And then build a support system. I mean, accountability is really good. So whether it is somebody helping to coach you, a spouse or a loved one, you know, somebody out there is going to care, and having that accountability is going to, you know, it's going to make it easier for them to eat the right things at home or make those right choices, or hold you accountable to not make the wrong choices. So how we can help, the big thing, like I said, I wanted to give as much information with this presentation on what you can do for yourself. I mean, if you can follow a lot of those things at home, you can drastically improve your condition. And time over subject, I mean, if you have the willpower, you can probably reverse the diabetes on your own. The red light therapy, again, that's excellent for helping stimulate the mitochondria, the energy source of your body, helping to excrete some toxins because you start to sweat and flush that out. IV therapy, that's something that we're going to have that up and running again here in probably this summer, in a couple months. The cool thing is with that condition, under metabolic syndrome, we're now getting insurances to start paying for that. So you can actually get your IVs covered by insurance. I would recommend anybody that if they're dealing with this stuff to contact us and get on the list for when we start doing the IVs again, because that's going to supercharge just that healing process. Supplements, we can get supplements, but again, the less that you have to supplement with because you're eating good whole food derived stuff, the better, but we're a great resource for that. Mentioned a couple times the gut detox, we got protocols for that. Obviously chiropractic care is our bread and butter here, just to help to relax the nervous system. But we have the ability to do tests, lab testing, so if we want to check your A1C, your glucose, your cortisol, your cholesterol, all the different things that play a factor into it. That can give us a better idea too, or you know, what are you deficient in for minerals that we can get you supplements. So lab testing is really good. We have a device we can do metabolic testing with. I mentioned the HRV testing. So we have lots of different stuff that we can test with. So basically, if I have somebody that's looking for more help, aside from, hey, here's good do's and don'ts, I'd sit down, do a consult, and then I would choose what type of test to order, and then say, hey, we can add these things to supercharge the recovery. And that's how we can help. That's a wrap. So Carly, my wife, she made some healthy goodies here. Do you want to come explain?
What I made.
Yeah, come stand here for my video. I got my video going.
Alright.
Teach your voice right now. Alright, it's pretty simple. I wanted to bring stuff that's very realistic, that people can do at their house easily, not something that you're having 15, 20 ingredients that you have to make it. So basically I have a veggie platter back there, which is super easy, but the dip I have like a ranch dip back there. I don't know if you've seen this, but Redner's, if you've shopped there at all, they have the Daisy brand. They have a chip dip, like a French onion dip, and a ranch one that if you read the ingredients on there, you can read them all. So if you're familiar with like the Hell of a Good brand that has a lot of dips, you read that, there's like 50 ingredients on there. I can't pronounce half the words. Redner's has the Daisy brand that has like 5-6 ingredients that you can literally read every single thing on there. So that's a really good swap just to make, that's easy. Has actual food ingredients in there. So I have that there with some veggies. The cheese I have there too, I have Kerrygold cheese, which is a grass-fed cow cheese. They sell that at grocery stores. Costco has real big blocks of it. So just another good cheese alternative is a grass-fed cow cheese. That's just a little bit better than the ultra-processed cheeses that you can get. Deviled eggs. So eggs, we eat a ton of eggs in our house. I'll make them with dinner even sometimes. The deviled eggs I made, there's a brand called Chosen Mayo, which is with avocado oil instead of your seed oils in it. Great mayonnaise to use as an alternative to like your Hellmann's and some of those other brands. So there are a few really good mayo brands out there that have avocado oil instead of the seed oils. So the deviled eggs are made with that mayonnaise. And then I have some mini beef sticks back there. So grass-fed beef sticks. Those are from Costco. They get really big bags of them there, but you can find them other places as well. But very minimally processed. You can read all the ingredients in there. Spices, grass-fed beef, real super easy thing to grab, and protein, high in protein to eat if you're hungry. I know sometimes if we're running late in the morning and didn't get a chance to eat breakfast, grabbing a few of those is a better option than like a granola bar or something that's high in sugar, trying to get that protein in. And then one other thing I have back there that you could even grab and take home, we have a little electrolyte packets we sell, like tubs of them here, but getting your electrolytes in, making sure that you're hydrated and that you have all those minerals, really great pick-me-up. And even if you're like craving a soda or alcohol or something, replacing that I found can be really helpful if you're craving a little bit something else. And that has like no sugars in it, salts and different things that are just really good for your body. Anything else?
And then I have a PDF I'm gonna email that has good foods to eat and then foods to avoid. So I didn't want to make the presentation all about like eat this and don't eat that. I wanted to explain the physiology of it, and hopefully it makes sense. Like, yes, like if we can fix the cell, your body can heal, and then you don't need to take medications. All right, I'll cut this off, and yeah, help yourself to